be told you have diabetes is bad enough. To be told that you're going to need insulin for the rest of your life is like pulling the rug out from underneath your feet. You get very scared, all you think about are needles, and you wonder how you're going to do this, and you think that it's not possible. Today, we're going to talk about insulin injecting. Insulin injections are much easier and less painful to do now than ever before. We'll review how to give insulin, the new versus the old. So let's start with talking about the beginning of insulin. Insulin was discovered in 1921. For over 3,500 years, diabetes was thought to be a distinct medical condition. 1920s, diabetes was thought to be a condition that started in your GI tract, and it was related to the pancreas. Before insulin was found and discovered, the only way to control diabetes was by diet. It was believed that a man from Romania named R.C. Palesco had discovered insulin. He started out by taking out the pancreas of dogs and found that when he did, they exhibited signs and symptoms of diabetes. So from there, he had taken this extract from the pancreas, and he would inject that into the dogs that did not have the pancreas and found that their symptoms got better. They continued to do studies with dogs, advanced to the cattle from the slaughterhouses, and from there they came up with insulin. In 1922, there was a teenager hospitalized for diabetes. He was given the first dose of insulin that was ever given to a human being and recovered quite nicely. Therefore, they had, in 1923, made insulin available to the public. Now, let's talk about some pros and cons of insulin. Insulin pens are easier to use. What it is it's a pen, and I'll show you. It looks like a pen, and it's pre-filled with insulin, okay, which is up in here. It has a needle that goes onto the top, and it's less painful. You don't see the needle, it's injected into you, and you just dispose of the whole cap. It reduces anxiety, it's more effective. It's thought that there's a less error rate with the pens as opposed to the needles. The old needles, you would have to draw up the insulin out of a vial, and from drawing the insulin out of this vial, it would dull the needle. So then when you go to give this to yourself, it would hurt because the needle was very dull. The percentage of errors is believed that it's less than 10% with the pen when you're doing small doses, and it's greater than 20% error with the needle, and that causes hypoglycemia or low blood sugar, so therefore the pens are more accurate and they cause less of a side effect. So let's review how to use the insulin pen. So before you do anything with the insulin pen, you're going to want to wash your hands very well. You're going to want to take the pen, you're going to take the cap off. You always want the cap on so that germs don't get introduced to the top of the pen. So you take the cap off. After you've washed your hands, you get yourself an alcohol swab. You're going to clean the top of the pen very nicely. You're going to clean around. You're going to clean the rubber stopper on the top. This will take any germs or any residue or anything off the top. You then will grab the cap, which has the needle in it. They'll always have paper on the bottom. You're going to take the paper off, and you're going to screw this piece, which has a needle that comes out the bottom, which is what pushes the insulin through that needle into you. You're going to screw that on. You're going to look at this, the vial area where the insulin is. You're going to make sure there's no air bubbles. Even if you don't see any air bubbles, click the pen a couple times. You're going to dial up 2 units. Now the dial, if you go past your 2, there's 2. If you go past, it's not a problem. You can always back dial, which is more effective than the others. You have to squeeze out the insulin and try and get the right dose. So you're going to do that. From there, what you're going to want to do is, this is to expel air from the pen. So you're going to push this. Now you should see some insulin come out the top. If you don't, which I did see, it was in the little piece here. If you don't, you can always dial back up to 2 and try again. It doesn't always squirt out. Sometimes it does. Most of the times it doesn't. You're going to take it, you're going to dial up what you need, dial up to 5 if that's what you need. You're going to take your pen, we'll use this as the stomach, you're going to push it in, push this, hold it for 6 to 10 seconds. Purpose is so that the insulin goes into your stomach and not out. After you've counted to 6 or 10, you release it, recap it, unscrew this, throw this in the sharps container, dispose of as your health department would tell you where it needs to go, and then you're done. Now, we know how to use the insulin pen and the benefits of the insulin pen over the syringes. Diabetes, when it first was found, was controlled by diet only. Then we moved on, we found the insulin, we've distributed that to the public, and we have gotten past the vial and syringe to the pen. Some of you may have diabetes, family members may have diabetes. Now, hopefully from viewing this video, if you know of anybody that does, or if one day you are told you do, hopefully that this will help you to become less fearful of insulin injections. I hope that after viewing this video and listening to what I have to say, I hope that it makes it so that if you are ever told that it's easier for you to transition into what you need to do to maintain a good lifestyle. Thank you for listening.